Welcome to our guide on managing fibroids through diet and lifestyle tips. Let's get started. Welcome to our comprehensive guide on fibroids, also known as uterine leiomyomas or myomas. These non-cancerous growths can develop in or around the uterus and are most common in women during their reproductive years. Now you might be thinking, Dr. Oz, fibroids sound scary, and I understand your concern. But the truth is, most fibroids are completely benign and don't cause any symptoms. However, when they do cause problems, it can significantly impact a woman's quality of life. That's why we're here today, to empower you with knowledge about fibroids, their potential impact, and what you can do to manage them. Let's start by understanding the most common type of fibroids, intramural fibroids. Imagine the wall of your uterus like a sturdy brick wall. Intramural fibroids are like little clumps of extra bricks that develop within this wall. They're the most frequently diagnosed type of fibroid and can range in size from tiny seeds to large grapefruits. Now you might be wondering, Dr. Oz, how do I know if I have an intramural fibroid? Well, many women with these fibroids don't experience any symptoms at all. However, larger ones can cause a feeling of pressure or heaviness in the pelvic area, prolonged or heavy menstrual bleeding, and even pain during intercourse. Next, we have subserosal fibroids, which grow on the outer wall of the uterus. Think of them like little bumps on a smooth surface. These fibroids can sometimes extend into the pelvis, and that's when they might cause problems. You see, when they push on surrounding organs like the bladder or rectum, they can cause discomfort, frequent urination, or even constipation. Now let's dive into submucosal fibroids, which grow under the lining of the uterus. Imagine them like little mounds pushing against the inner lining. These fibroids are often the culprits behind heavy menstrual bleeding and can even protrude into the uterine cavity. This can sometimes lead to fertility issues, as they can interfere with the implantation of a fertilized egg. Now, imagine a fibroid growing on a stalk, like a little mushroom. These are called pedunculated fibroids, and they can grow either inside or outside the uterus. Now, here's the thing about these stalk-like fibroids. If the stalk twists, it can cause sudden, severe pain. It's like a kink in a garden hose, cutting off the blood supply. So, what causes these fibroids to develop in the first place? Well, it's a bit of a mystery, but we do know that hormones play a significant role, particularly estrogen and progesterone. Think of them like fuel for fibroid growth. That's why they're more common during a woman's reproductive years when these hormones are at their peak. Genetics also seem to play a role, so if your mother or sister has a history of fibroids, you might be at a higher risk. Now, how do you know if you might have fibroids? Well, it's important to listen to your body and be aware of any unusual symptoms. Heavy or prolonged menstrual bleeding is a common sign, often much heavier than what you're used to. You might also experience pelvic pain or pressure, like a constant ache or fullness in your lower abdomen. Frequent urination or difficulty emptying the bladder can also be a red flag, as fibroids can press on the bladder. The good news is that most fibroids don't require treatment. If they're small and not causing any bothersome symptoms, your doctor might recommend a watch and wait approach, monitoring them over time. However, if your fibroids are causing significant symptoms, there are effective treatment options available. Hormonal medications, like birth control pills or GnRH agonists, can help regulate hormone levels and shrink fibroids.